Our series, High Noon, continues. Earlier in the hour, we took you to a medical marijuana dispensary. But to get medical marijuana, you have to have a doctor's approval. So how do you get a doctor's note? Our next guest has the answer. Joining us, Dr. Alan Frankel. Doctor, thank you for being with us. That is the big question here. How do you decide what patient gets a prescription for medical marijuana and one that does not?
Well, every physician will have slightly different standards. One of the most important standards that I operate under in my office is the age of the patient. If they're not in with a parent, they have to be at least 21. The average age is 48, so most of my patients are really about as sick as they were in my internal medicine practice, and it's not difficult to decide.
You know, doctor, a lot of people, when they get into this argument about legalizing marijuana, they talk about, you know, well, we did the prohibition thing on alcohol, but then we said, okay, that's legal. But you and I can go and have a drink or a glass of wine or whatever, and we're not high. We can still operate a car, operate machinery. But when you smoke a joint, you're high. So how do you classify this more like, instead of the alcohol argument, wouldn't it be more like codeine, something that you should get from, again, a pharmacy?
Well, not necessarily. In many pharmaceutical drugs, including the tranquilizers and narcotics, are much worse to drive under than either alcohol or cannabis. So it's most, first of all, my responsibility as a physician is not to get people high. The vast majority of my patients know how to get high, and if they want to just get high, they'll do it in one of many different ways. My goal is to primarily by using tinctures and not so much by using smoking, which is very difficult to control, to get people to feel well, to feel normal, to get rid of their pain, to alleviate their anxiety without getting high. Most of my patients really don't want to smoke. Most of them want to use alternative mechanisms.
Most of your patients, don't they, a lot of your patients are suffering from AIDS, cancer, different types of bone ailments. I mean, aren't you primarily prescribing things to folks that have very serious illnesses and have chronic pain because of said illness?
Well, I would say that about a third of my patients have cancer, HIV, or debilitating illnesses that we're used to hearing about it. Right. About a third have been to physicians, have had multiple prescriptions for the depression, anxiety, pain, and insomnia, and just aren't doing well, and they seek cannabis for help. And I'll say the last third are what I call the walking wounded. You know, it's yourself, myself, with anxiety, mild to moderate chronic pain, insomnia, and depression, and they've often tried other meds, and they find this to be more effective.
What do you make of the news today from the Obama? Yeah, I mean, I want to know what you make of this news today from the Obama administration. The Attorney General, Eric Holder, now coming out and saying he is no longer going to go after folks like you, small business owners that dispense medical marijuana. I mean, do you think that we're making a step in the right direction here as far as the medical community and the treatment of chronic conditions goes?
Well, first of all, I don't distribute cannabis. I distribute.
You prescribe. You prescribe. I know. You prescribe. Sorry.
I recommend. I recommend.
Okay.
I recommend.
And what is that? What are you holding? What are you holding up there? I'm sorry. What was that piece of paper?
Is that good?
Yeah. And that is a card, right?
This is the card or the physician recommendation letter. It has the picture of the patient. It has everything the law requires. In my office, I do it electronically rather than by hand. But this will get this patient illegally into any legal cannabis dispensary in the state of California.
I don't mean to be picky. Maybe I'm just playing off words here, but you've corrected a couple of times now. The word prescribe, you don't use that. You say you recommend. You make a recommendation. What's the distinction? What's the big deal there?
Well, the distinction is that even though cannabis in a medical setting is legal in the state of California, federally, not quite yet, but it is legal. But cannabis is a Schedule I drug, period. So it can't be given by prescription. And the recommendation is the form that California uses to get the patient to the dispensary.
How many patients are you treating right now? Recommending medical marijuana
I would say in the last,
too. How's that?
about 2,500 patients over the last 3.5 years.
Okay. And have you been approached by anybody from the investment community that as we see the administration kind of change their tune about medical marijuana, have you been approached or have you been in discussions where people have talked about maybe opening up dispensaries around the state, maybe profiting from medical marijuana?
Well, it's not just dispensaries anymore. Since, I would say, January, the election time when people, I think, settled down a little about the whole cannabis issue on both the federal and the state level, I started seeing business people from the community coming in and talking not just about a dispensary issue, which is not something that I would want to get into discussing with them, but possible other opportunities for investment in the medical cannabis field, of which there will ultimately be more and more, but there are certainly a number now.
You know, Cheryl was talking
such
earlier.
As laboratories.
Cheryl was asking you earlier about the fact that the Obama administration is making a change to the Department of Justice, but I was just reading a story today that says LA's top prosecutor vows to target pot shops. So which is it? How are the people in this business going to operate when you've got the Fed still saying something different than the state?
Well, I don't think any of us know what's ultimately going to happen, even if we have a bill or a proposition that legalizes it to the level of alcohol for people over the age of 21. Even at that point, I'm not sure that we really know what the federal government is going to be doing. But I think for right now, Obama formally stating that he's going to leave it up to the state is actually very similar to alcohol. The federal government couldn't make a decision with alcohol prohibition, so they waited and allowed it to be state by state. So I have a feeling, I'm guessing, of course, but I think that's what's going to happen in this case.
Dr. Alan Frankel, thank you very much, doctor, for giving us the medical side of medical marijuana. We appreciate your time.